Okay, well, good morning. It is great to be here in Scarborough, and I'm delighted to be joined by Deputy Mayor Michael Thompson, who's been somebody that's been extremely helpful to us, not just on the COVID response and all that has to do with the vaccinations and so on, but very much so from day one. We knew that we would have a major challenge dealing with economic recovery, and I think when we started all the planning, we thought it might be 3 or 4 months later after that sort of fateful March of 2020 when this all began in earnest. But of course, it's turned out to be a much longer process than that. But he's been working hard with many others in the business community and otherwise to help us to make sure that we can come back, as we say, stronger than ever, which I'm confident that we're going to be able to do. And of course, our Chief Medical Officer of Health, Dr. Eileen de Villa, who has been a mainstay and a constant source of very professional, balanced advice that's helped us to get through. And we're here at the Scarborough Centre of Healthy Communities. This is a remarkable place that's started to do all that it does. And it's not just about a vaccine clinic. In fact, it's much more than that. A long time ago, decades ago, under the leadership of the United Way and many other community organizations. And it's what we call across the city a community hub, where lots of good things, helping seniors and helping families and medical and dental care and all kinds of things that reach out in many cases to marginalized communities and provide them with services in one place. And these are really miracles that exist across our city. And so it's only logical that because it's a place that people are used to coming to for all kinds of things. They know where it is, they know what it is, they know the people who are here. We have in turn used it as a vaccine clinic location because we have been moving more and more and more as time has gone on, not only to taking the vaccines to where people are, but also making sure the people who are there and the people who reach out to them in their buildings, floor by floor, are people that are known and trusted by those who have not yet been vaccinated. And so this clinic was opened yesterday, and it's part of the overall program we have for the Halloween weekend. This one will be vaccinating people here until 2 o'clock today. And people visiting what we're calling the Vax and Treat clinics are more than welcome, we should say, to wear a costume. I will tell you, in all honesty, we looked at the question of whether, public health staff, and you can see the hardworking staff behind me, and they're a great team that's gone from place to place to place as part of our mobile clinics, and whether they would be in costumes. We didn't talk to them about it because they might have just said, no, that's a bad idea from the beginning. But, we just concluded, and I hope people will understand that while we're going to do this on Halloween weekend and make sure that we have lots of clinics for people to attend, that it is better in a circumstance where we have some people who are hesitant about vaccinations and just because it's a very professional setting with a very serious, medical procedure that people are having, that we should keep it that way. So I hope people will understand that. We will have more than 26 clinic locations operating in 17 neighborhoods, which Toronto Public Health have told us are the neighborhoods in which we have low vaccination rates. And there's a complete listing of those clinics at toronto.ca/COVID-19. But we are, again, continuing with our targeted approach to communities which have had a lower vaccination rate on the basis that is going to what is going to help us the most to get to that coveted 90% target. So we have chosen locations for this weekend, as we've done in other weekends, but this is probably the broadest ranging weekend of all, to have those clinics in malls, in schools, in hospitals, in community centers, in community hubs like this, so as to make it easy for people to find their way to a place where they can get vaccinated. And that is why we are making steady progress. It is, as I've said a number of times in the last few weeks, slower progress now because in the early stages, people were flocking to the mass vaccination clinics and now we're dealing with people who perhaps have had some issues getting the information they needed or have had some degree of hesitancy about getting vaccinated. But nonetheless, we're at 83.7% of eligible people in Toronto who are double vaccinated. They've had the 2 doses, and we're at 87.5% of people who've had at least 1 dose. And we continue to see those numbers moving up as we have these clinics in different locations. That is excellent progress, but we need to keep going. So we're here today in Scarborough to send a message loud and clear. It's the same one. It doesn't change. And that is a request, please, to get vaccinated. And if you are vaccinated, have had your double vaccination already, please encourage someone who has not yet had 1 or both doses to complete the vaccination process. We still have a significant number of people, although that number, again, is slowly diminishing, who've had 1 dose, but not the second. We are making progress on our last mile campaign as well. And this is a campaign that was focused in the 16 neighborhoods where we're trying to drive up the lowest vaccination rates to get them to something closer to the citywide average. We have seen an overall 21% drop in the number of unvaccinated people across the city from August 19th to October the 21st. So people who are not vaccinated at all, that number has dropped 21% across the city in the period between the end of August and the end of October. But in many of these 16 neighborhoods, we've done better than the overall average. For example, in the Black Creek neighborhood, which is in the kind of Midwest part of the city, we've seen a 35% drop in the number of unvaccinated people between August and October. We've seen a 29% drop in the number of unvaccinated people here in the Malvern neighborhood of Scarborough. This is good, steady progress in the areas that had the lowest vaccination rates, and we need to make a difference in those areas more so than anywhere else, although we have to keep pushing the numbers up across the city. While our work to get 90% of our eligible residents vaccinated is continuing, we're also continuing to get ready for when the vaccine will be available to protect kids between the ages of 5 to 11 who are not as yet in a position to be vaccinated because of government approval is not yet forthcoming, but we expect that to happen, as you've seen from news reports. And so I'm very proud to announce that Team Toronto will be sending out surveys to all parents of 5 to 11-year-olds in public schools today. And this is an invitation that will also be going to independent school parents as well. And when you look at the survey, as I've done, you can see there's all kinds of very valuable questions that will help Dr. Davila, and she'll have more to say, to make sure we can plan this as efficiently and effectively as we have done with the overall vaccination program. So it talks about where, for example, parents would like to see their children get vaccinated just on the basis of what's most convenient. It talks about some of the hesitations that either parents or their children might have, a fear of needles and this kind of thing, so that we can have that information on a citywide basis, but it helps us to make the plans that we have to make. In addition to the outreach that is consisting of the survey, we're going to be having 15 outreach and educational town halls and webinars for parents and for newcomers and for partners in the child and family services sectors, the community agencies that work with us, and our community ambassadors who've done such a great job of literally sometimes going door to door encouraging people to get vaccinated. And this is in preparation for a new chapter of their work, which will involve that same kind of advocacy and assistance with the 5 to 11-year-olds and, of course, their parents. Dr. Davila will explain this morning why this work is so important and how it will help us to get kids vaccinated, because it is more complicated, to have young children of that age getting vaccinated and the involvement, of course, of their parents, whereas adults can make their own decisions about these things. I talked earlier about the progress that we've made in getting people vaccinated, and I just want you to think of how far we have come in 19 months. I made reference to those early days when, quite frankly, people, Dr. Davila, myself, Councillor Cressy, Chief Pegg, were the ones sitting around the table. We were talking a lot with people like Deputy Mayor Thompson just about this whole thing. And we thought it might last a few months because nobody really knew. I mean, and of course, it's lasted much longer than that. But there is no sign that things are getting better and that we are on kind of a cautious path to a more normal life than Halloween coming up. I know many people are looking forward to celebrating Halloween with their families and with their friends and their neighbors. And of course, we encourage people to have fun, but to be safe at the same time. And that involves some things that Dr. Davila has outlined before. They're pretty straightforward. Don't congregate in large groups, even though it's outside on people's front steps or even inside their homes. Try to have kids and adults wearing masks as often as possible, just to be safe when it comes to the pandemic. I'm looking forward myself to being out with my grandchildren on Halloween. And of course, we couldn't do that last year, and it's going to be fun to be able to do it again, and for kids across the city as well. I'm also delighted to announce today that the pumpkin parades, which are annual but weren't annual last year because they were canceled like so many things during the pandemic, will be back this year. And that's another sign of the progress we're making in confronting COVID-19. This is a made-in-Toronto tradition that has spread for good reason to other communities, and it's spread even in our own city to parks right across the city, and inspired other cities like Montreal and New York and towns in the UK to start their own pumpkin parades. On November the 1st, the day after Halloween, more than 35 parks across the city will be lit orange with jack-o'-lanterns that are brought to the park as a collective final farewell to what I hope is a happy and safe Halloween. The very first pumpkin parade was organized in Sauraran Park in 2004, and they're now in parks right across the city, from Terraview Park in Scarborough to Centennial Park in Etobicoke and many places in between. The pumpkin parade was officially adopted by the City Council as something the city would support in 2013, and there have been about 270 parades that have taken place in the city since then, with about 65,000 people that have come to those parades. And they're organized by community organizations, by BIAs, and by city councilors in some cases, and the parks bookings are provided free by Parks, Forestry, and Recreation. And I want to especially thank, because there's always something that we're trying to accomplish that's a good civic purpose here in having these parades, besides people having some fun. And the city solid waste department helps us to provide disposal bins so that we can take those pumpkins and make it quick and easy after the event, as opposed to past days I remember well, where a lot of them seem to end up on the street. And in this case, when we collect them, it makes sure that those pumpkins are taken to our organic waste processing facility to be broken down and ultimately returned to some of those very same parks as compost material. So a map of where all the pumpkin parades are taking place can be found at toronto.ca/pumpkin parades. And people who are attending those parades or planning to take part are encouraged to post their favorite creations online using the hashtag pumpkin parades. I hope everybody does have a safe Halloween. I hope lots of people take the opportunity to come to one of these dozens of clinics that we're having this weekend to get vaccinated. We've got to keep pushing those numbers up. Pushing those numbers up gets us to the stage where it becomes more viable, in the professional opinion of our medical officer of health, to reduce restrictions, to tell people that it is okay to return to things that they've missed very much, including, being at work, including all kinds of different things that people are still not doing. Sometimes not because the law says they can't do it, but sometimes because they're just concerned about the level of vaccination and the level of COVID and Delta variant that are still out there. So please take the opportunity this weekend to get vaccinated. We're going to keep coming back weekend after weekend, week after week, with more and more different kinds of clinics to make sure we give people the opportunity and that we bring the vaccine to them. And on that note, I would like to ask Dr. DeVille if she would offer her report for today.
Thank you, Mayor Tory, and good morning, everyone. I think it's absolutely wonderful to be here at the Scarborough Centre for Healthy Communities and to visit the Hub Community Vaccination Clinic. First and foremost, I would like to thank the staff here and thank as well the thousands of members of Team Toronto that have contributed to our city's vaccination efforts. It's remarkable to think that it was just a few short months ago that we didn't have a vaccine for COVID-19. And now it's clinics like this one here in Scarborough that have been essential vaccination partners towards delivering millions of vaccines here in Toronto. And now, almost 10 months since the first dose of COVID-19 vaccine was administered in Toronto, we're here to talk about another incredible feat. We hope that we are only weeks away from when the first COVID-19 vaccine for children will be approved for use in Canada. Toronto Public Health, along with our Toronto Hospital and Healthcare and community partners, are preparing to vaccinate children between the ages of 5 and 11 years once the vaccine is approved for this age group and the Ministry of Health provides the vaccine. Today, as you've heard the Mayor say, Toronto Public Health and the city's vaccine partners are inviting parents of children who are 5 to 11 years old to complete a survey about COVID-19 vaccinations. This survey will be an important component in our planning and distribution of vaccines across the city. We want to hear from you. We want to hear from parents about your intentions, your thoughts, and your preferences as you consider when and how you will vaccinate your children against COVID-19. The survey will be open until November the 7th, and you will receive an invitation through your school to participate. In addition, we also want to be available. We want to make sure that all vaccination partners are available to help answer your questions about vaccination. So for us, that's why we have started a series of education sessions and town halls all designed towards building vaccine confidence and making sure that you have opportunities to get your questions answered. These town halls will help to prepare parents and the community agencies and members who help support the vaccine efforts with facts about COVID-19 vaccination, and in particular, facts about COVID-19 vaccination and children. It is essential that children aged 5 to 11 are vaccinated against COVID-19. This important step not only protects children from contracting COVID-19, but provides critical protection to members of their family, to those around them at school, and to their entire communities. So to parents and guardians, if you or another eligible member of your family have yet to receive 2 doses of COVID-19 vaccine, I ask that you make it a family affair and get every member of your family vaccinated. COVID-19 vaccine remains our best protection against serious illness and hospitalization associated with COVID-19 infection. We will have more information in the coming days about our plans for this next phase of the COVID-19 vaccination campaign. And as we await approval from Health Canada for these COVID-19 vaccines for 5 to 11-year-olds, I ask that parents and guardians throughout the city start reflecting on their intentions, start asking questions, and please seek out the information you need to make the decision, but do so from credible sources of information. A great first stop is the toronto.ca website, where we have a dedicated toolkit on COVID-19 vaccines and children. Together, we can bring an end to this pandemic. And I can assure you that vaccination is key to making this happen. With that, I'll now turn it over to Lavin, and we'll take some questions.
Thank you, Dr. Davila and Mayor Tory. We will now open the floor to questions. First up, we have David Ryder from the Star. Go ahead.
Hi there. First couple of questions I think are for you, Dr. Davila. Number one is you said, and your board, Toronto Public Health Board, advocated that the COVID vaccine be made mandatory along with about 9 other vaccines for school-age kids. Yesterday, Dr. Kieran Moore, the Provincial Medical Officer of Health, said that's not going to happen. Can you tell me what that means in terms of your efforts to get as many kids vaccinated? Do you have to pivot? Do you have to change things? And what does it mean for the potential level of infections in Toronto?
So thanks for the question, David. And I would say this, the entire course of the COVID-19 pandemic and the response to the pandemic has required shifts and changes in accordance with what we're seeing on the ground. So we did hear that statement from the Chief Medical Officer of Health yesterday. And I think it just means to us at the local level that we need to continue to redouble our efforts to ensure that people have access to the information they need around COVID-19 vaccine in children so that they can make the right choice, which ultimately will be for vaccination. We have seen how significant a difference vaccination has made to the course of the pandemic. And I'm certain that when we have conversations with parents and guardians of young children, that, with the appropriate information, they'll make the right decision, as so many Torontonians, millions of Torontonians already have.
So if you can boil it down, what exactly is your message to parents who are going to be weighing this and considering what's best for the safety and health of their child?
I think very simply put, David, as I've mentioned, vaccination has made a significant difference. It is the key tool in our pandemic toolkit. That's not to take away from the other public health measures, which have also played a role, but we know how significant vaccination is. So when it comes to children, please do have the conversation, ask the questions, but ask them of reliable sources. And I think at the end of the day, when people get the right information, scientific, evidence-informed information, they'll realize that it makes sense for them to get their 5 to 11-year-old children vaccinated. It makes sense for them themselves, if they haven't yet been vaccinated, to get vaccinated, as this not only protects the vaccine recipient, but in fact protects everybody around them.
And if I understood the information at the health board meeting earlier this week is that you expect there to be enough vaccine supply that essentially all Toronto kids age 5 to 11 will be able to get it at once. It wouldn't sort of be stage gated by age the way it was with the general rollout. And also, but there is going to be targeted efforts to areas with lower vaccination or higher risk. Can you parse that out a little bit about how that's going to work?
Sure. So, and I think I can parse it out a little bit, but of course, it's important to recognize that the supply of vaccine, procuring vaccine is a responsibility of the federal government. They in turn provide the vaccine to the province, who then provides it at the local level. And we, with our vaccination partners, are responsible for ensuring that those vaccines are administered to people in safe and appropriate settings, like the clinic that we have here today. Of course, we're trying to make sure that there are multiple channels available. So we've got clinics like this one. We have our own mass immunization clinics through which these vaccines will be distributed. But of course, there are pharmacies, doctors' offices, and mobile clinics, in addition to other existing healthcare clinics that are going to be up and running to make sure that we're providing this vaccine as efficiently as possible and through as many channels that make sense for parents as possible. I think one unique feature for the children's vaccination campaign will be the presence of school-based clinics as well, supported through the appropriate healthcare partners to make sure the conditions are safe there. So our current understanding is that there is sufficient supply that's being procured by the federal government, and our expectation is, as a result of that, that there shouldn't be the need to stratify or stage the administration of the vaccine. But of course, we have yet to hear specific details from our provincial counterparts, and as those details become known, we of course will share that with the public.
A couple of questions for the mayor, please.
Can I just add one thing to what Dr. Davila said? You know, there are moments you sort of remember as we go through all this. And I remember having a couple of conversations with Dr. Davila maybe 3 or 4 months ago when the Delta variant was really, you know, kind of on the move and infecting a lot of people. And we were talking about what measures could be undertaken. And she said to me then, and it turned out to be absolutely true if you connect the dots, that, you know, vaccination, you know, was the answer, because all of these other measures might have had some positive impact in terms of keeping social distance and having masking and avoiding places where there were crowd scenes. And I think if you look at what has happened as we've pushed the numbers up in Ontario and in Toronto to levels that are, you know, in the top ranks globally, it has been true that there has been a correlating, you know, drop in the number of cases and other indicators that have all moved in a positive direction. And that is why from that day forward, we placed our emphasis, as we continue to do, on vaccination, because it has proven to be, just based on our own experience and elsewhere, to be the key to, you know, to making progress and putting us in a position where we can reopen. Please go ahead.
Starting next week, city staffers who, as I understand it, are completely unvaccinated or not disclosing, are going to be getting a talk from their manager and the start of suspensions that could lead, if they don't get vaccinated, to termination. I think you probably have an updated list of which departments have the most people that are in that position. Are you as confident as the city manager seemed to be earlier this week that we're not going to see service disruptions for the general city workforce, like we're seeing a service reduction for the TTC?
Well, there are 2 reasons why I'm confident that people will not experience service reductions that are in any way really noticeable. The first is from the fact that we have done contingency planning, so that in the event there are people, which we hope there isn't the case, but if there are people who end up not able to be at work because they haven't been vaccinated pursuant to the policy, that we will have plans in place behind those people and their positions to get the job done for the people of the City of Toronto. But the second reason, and the one that in a way is more relevant to all of this, is because the numbers continue to improve with respect to the number of city employees who have both disclosed their vaccination status, which is now at 98%. That continues to rise. The number of those fully vaccinated are 93%. The number partially vaccinated, and these are up to date as of today, at 4%. So we have 97% of city employees who have declared themselves as being partially or fully vaccinated. And it leaves us with a relatively small number of people. I mean, it's not a dozen, but it's a relatively small number out of a workforce of 35,000 who have not either indicated they're not going to get vaccinated or who have not yet indicated their status. Those are the people behind whom we have put a contingency plan, and I'm optimistic that that plan will be such that it can result in us continuing to deliver services to the people of the City of Toronto in a way that I think will be to their satisfaction.
And what's your message? If there's an employee right now, I'm sure there are some city employees who say, you know, I don't agree with vaccination, I don't understand or want to put it in my body, but I shouldn't lose my job with the City of Toronto because of that. What do you say to those people?
Well, I say that I understand that people have concerns about these kinds of things, and that that I think our job is to continue as we've done. If you look at where these numbers started with the TTC, with the police service, with the City of Toronto Public Service, and where they are today, we've sat down with and done it in a very careful way. And even now, as we reach an important turning point in this entire timetable, the step that we're taking is to sit down with these people. Their managers will sit with them one-on-one individually to have further conversations with them, to hopefully be able to reassure even more of them that the vaccination process is safe, that it is in the best interest of their own health, but also the health of the people they work with and the health of the public that they interact with to get vaccinated. And, this is very much an occupational health and safety matter. And we would not indicate too much compromise on things like not wearing proper safety equipment or not following proper safety procedures. These are important matters that can dramatically affect the health of others, let alone yourself. And so I would just say that I would hope that this kind of process of discussion and reassurance and comforting and informing will result in a very tiny number that end up at the end of the day not getting vaccinated, and that will be, I guess, as successful as we can make it. And that's my hope. And that has been our approach all the way through from beginning to end, and we're not at the end yet.
I know you'd be disappointed if I didn't ask a Rogers question. So
And you'll be disappointed if I don't answer it.
Rogers question. So I'll just say, I've seen you in the interviews on TV this week, sort of expressing some frustration with anybody questioning your work ethic or the hours. I think anybody like me who follows you knows you put in probably as many or more hours than any mayor we've had. I just want to know if you can acknowledge that, like you were asked about if you're going to disclose what happens in a Rogers meeting. You said, well, no, I couldn't. That for a mayor of a fourth biggest city in North America to be enmeshed in something that is completely divorced from city activities and is in the news all the time, but you have to say, well, I can't talk or disclose what's going on. Do you acknowledge that it's an unusual or awkward situation?
I will just say that I think people trust my judgment on these kinds of things. I think they trust that I would never get myself into a position that would in any way cause any rules to be other than completely followed. And I have done that scrupulously and will continue to do so. And beyond that, I just hope that what can in fact happen is that things will calm down on the Rogers front, and that what is something that is a very limited assignment most of the time will revert back to that. And so, other than that, I don't really have anything more to say about this. And I continue to do my job. And, police board yesterday, today here at the vaccine clinic, and many other meetings through the day, on the weekend, out at vaccine clinics and other events. And so that's just what I will do. But I always keep an eye to, to the people and how they talk to me about what they think of the job that we're doing and some of the issues we have to confront. And I will continue to listen to them.
Okay, that's it for today, everybody. Thank you and have a great day.